So basically, a scoliosis is a deviation of the spine. Everybody's spine should be pretty straight when looking at it from the front. A deviation of that, when it starts to curve, either an S or a C, is what we call scoliosis. There's different types of scoliosis. By far the most common scoliosis is something called idiopathic scoliosis, which are healthy teenagers get, and that's what people come and see me for. And curable, there's no real cure for it, but there are surgical corrections in which we make the spine straight if it gets to a certain level. By far, most spines don't ever get to those levels, and that's important to see a professional, either a pediatrician or an orthopedic surgeon, to make sure that that doesn't happen, or if it does happen, they can be taken care of. There are certainly predispositions for females to have that, and teenage females are our demographic that we really look closely at, and those are the people that are getting screened at schools, and that's our target patient. It can certainly happen in older kids, younger kids, and in boys for sure. We know that once you have a family member that has scoliosis, it's much more common for you to have it, or for it to appear in your family. And if you see something, you know what your kid looks like. If something looks off, if their shoulders are uneven, if their hips are uneven, and you are worried, we'd be happy to see them and evaluate it. There's no research to suggest that heavy backpacks cause scoliosis. I know in the community that's a thought, but we have pretty good research suggesting that there's no kind of activity or weight in your back that will cause scoliosis. Like I said, there's other illnesses that can present with scoliosis, and wouldn't be idiopathic scoliosis. But idiopathic scoliosis is not caused by heavy backpacks. Heavy backpacks can cause back pain and some other issues, but not scoliosis.